Hello guys, welcome back to this series. This is going to be the fourth part of our RRB important MCQs. So let's begin with the first question here. So the first question says, which of the following is a key requirement for power systems in hemodialysis machine? So what will be our key requirement for power systems? And they have said that the dialysis machines work for long duration and they contains multiple components and they require power. So the first option here says AC line powered with multiple output switching regulators. Option B says power supply dash that does not require cooling. Uh, this is not correct actually. Option C says no self monitoring feature. That is also not right. Option D says a single output power supply. A single output power supply is not reliable. What if it does not work? Then all the key features, since dialysis machines contains multiple components and they all are requiring powers, if there is problem in single output power supply, then everything will be shut down. So that's why the right answer will be A, AC powered with multiple output switching regulators. Let's see the explanation. Here, hemodialysis machines runs for long hours and power many systems simultaneously, such as pumps, heaters, monitors, alarms. Therefore, they need a stable AC power supply with multiple regulated outputs and safety monitoring. A simple single output or non-monitored power system would be unsafe. That's why we cannot use them. Moving ahead, second question says, which blood vessels are responsible for carrying oxygen rich blood from lungs to the heart? This is very important and I think a very basic question of biology. So the first option here is vena cava. Option B is pulmonary veins. Option C is coronary arteries, and option D is pulmonary artery. So I guess everybody know the answer. Answer is B. Pulmonary veins carry oxygenated blood from lungs back to the left atrium of the heart. This is unique because this is the only vein that only vein that contains oxygen rich blood. Uh, Otherwise, every vein contains deoxygenated blood. Moving ahead, the third question in the series says, an essential part of infection control practice and a key measure in preventing nosocomial infection. So we have four options here and we have to uh, choose the one which is correct. So out of these four, which practice is key measure in preventing nosocomial infection? Nosocomial infections are infections which are spread by the surrounding areas of the patients. So first option is wearing surgical caps. Uh, it is not a key measure, so answer will be no. Administrating antibiotics to all patients, this is a big no because they are going to develop a resistance to all those antibiotics, so that's a big no. Option C says using air fresheners in ward. No, that's not correct. So the last option is using antiseptics and disinfectants. This is the right here. So let's see the explanation. The most effective way to prevent hospital acquired nosocomial infections is proper cleaning and disinfection. Antiseptics for skin and disinfectants for surface and equipments are essential in dialysis units to prevent cross infection. Moving ahead, the question says, which condition is characterized by progressive degeneration of arterial walls? Progressive degeneration of arterial walls. Arterial walls often associated with aging and hypertension. So option A is arteriosclerosis, option B is atherosclerosis, option C is aneurysm, and option D is thrombosis. Now here the key thing that we have to know is it is associated with aging and hypertension and we are talking about the arterial walls. So the answer will be arteriosclerosis and not atherosclerosis. Arteriosclerosis refers to general thickening and stiffening of the arterial walls, commonly due to the aging and hypertension. While atherosclerosis is a specific type involving plaque buildup, but the broader degenerative condition is arteriosclerosis. So, arteriosclerosis was the right answer. Moving ahead to the fifth question of the series. Uh, in a dialysis unit, the dialyzer and tubing used for hemodialysis should be disposed of in which color coded bag? So this question is from BMW part BMW. So the answer will be yellow, red, white, or blue. Choose the right option. So this is, I think, this is very basic question, but though it is also very important and is commonly asked in all examination and especially in railways. So the answer will be red bin. The red bin is used here in biomedical waste segregation. The blood contaminated plastic items like dialyzer and tubings are disposed of in the red bags. However, the yellow is for anatomical waste, white is for sharps, and blue is for the glasses. So this is very important. Moving ahead to the sixth question of the series. It says proteins are formed by the polymerization of amino acids through peptide bonds. What is formed when only a few amino acids are linked together? So he's saying that uh, proteins are formed by polymerization of amino acids, but what if only few peptide bonds, only few amino acids are linked together? So only few amino acids are linked together. If in that case they are joined through peptide bonds, so what is this particular compound to be called? Option A is oligopeptide, option B is protein, option C is peptide, and option D is polypeptide. So answer here will be oligopeptide. Oligopeptide, when only few amino acids join together, they form oligopeptide. Short peptide chain, longer chains forms polypeptides. If the chain is long, then we call it polypeptide. But in the question, they told us that only few amino acids are there, so they are to be known as oligopeptides. Moving ahead to the 37th question. This question says if the pre-dialysis blood urea is 60 mg per deciliter and the post-dialysis is 18 mg per deciliter, what is the URR, urea reduction ratio? So what is the urea reduction ratio? We have to know the formula in order to solve this question, and we have to understand how are we going to solve this question. We have to know the formula, and formula is we have to subtract the pre out of post and then divide by the pre and into 100, and we are going to get our urea reduction ratio here. So let's see the answer. Pre-urea minus post-urea divided by pre-urea into 100, and here we get the answer, that is 70%. Urea reduction ratio measures dialysis adequacy by showing how much urea is removed. Moving ahead to the 38th question and 8th question of this part. It says which peritoneal dialysis modality is used in urgent situations involving uremia and fluid overload, commonly referred to as urgent start peritoneal dialysis. So in urgent situation, what type of PD modality we are going to use? So the answer is acute PD. Acute PD or acute peritoneal dialysis is used in emergency situations like severe anemia, hyperkalemia, or fluid overload when urgent dialysis is required. It is often called as urgent start PD. So by name also it is also known as urgent start PD. Moving ahead, the next question says what indicates the presence of residual formalin when using Schiff reagent? So what color we are going to find when we have to check formalin and we apply the Schiff reagent. So we generally found red and violet color. Schiff reagent turns red or violet in the presence of residual formalin or formaldehyde. This test ensures dialyzers are safe before use and not exposing patient to toxic formaldehydes. So Schiff reagent is a simple test which is used to check the presence of residual formalin or formaldehyde in the tubings, so that if it is present we will be aware and the patient will be not exposed to such toxic chemicals. Moving ahead and to the last question of the series, uh, which of the following best defines osmosis in context to renal dialysis? So we have four conditions and we have to select the one that best define osmosis. So first option says movement of water from low solute concentration to high solute concentration across semipermeable membrane. Option B says movement of solutes from low concentration to high concentration. Option C here says active transport using ATP. And option D is passive movement of solutes due to pressure gradient. So what will be the answer? So the first statement here is correct. The movement of water from low solute concentration to high solute concentration across SPM. Osmosis is the movement of water across semipermeable membrane towards higher solute concentration. Because in osmosis, whenever we talk about osmosis definition, we always talks about the solvent concentration. So it is the movement of water, or we can say solvent, across a SPM towards higher solute concentration. In dialysis, this principle helps remove excessive fluid from the blood. So this was the last question of the fourth part. We will again meet in the fifth part and discuss further important questions related to dialysis which are relevant for your RRB exams. Make sure to like this video and hope you are enjoying this series. Thank you.